Everybody go. And I don't know no better, but as far as I came, it felt like forever. Seconds turn to hours, days turn to months, let a year pass by, but don't feel like much. So if I got one chance, I'ma make y'all dance. I'ma have as much fun as I can and figure out the rest when I edge out a plan. Tonight is the night, is the night that we're losing control. Tonight is the night, is the night we set it off. Everybody go.
Hey Victor, how are you? Hi, my name is Tony, I'm the clinical manager, okay? And we've invited you here today. This is your treatment team, okay? And this is where you get to meet with the multidisciplines that are part of your care here. Your psychiatrist, your social worker, your charge nurse, your case manager, and the management team. And we're actually going to review with you your individualized plan of care, okay?
Okay.
Good morning. How are things going here?
Oh, not too bad.
Okay, good. Medicine's going okay?
Yes.
Alright. Sleeping alright?
Absolutely.
Your appetite's good?
Yes.
Do you feel like any problems you're getting from the medicine you're taking?
No.
Okay. So one of the things that we're going to talk about before you leave is getting you on like an injectable. That's going to be like a monthly injections. Because you've had problems taking medicine in the past. So this will be like a monthly injection so you don't have to take pills.
That sounds nice.
Okay. And then, so this is part of like Tony explained, the interdisciplinary plan, plan of care treatment. So we're also going to do some of discharge planning right now too.
Okay.
All right. So that's why we have everyone here. If you have any questions, you can ask any one of us whatever you need. Okay.
Okay.
So we'll go around just so that you know everyone here. You probably know some of the people already. So we'll start with Amber.
Hi, I'm Amber. I'm one of the social workers here.
I'm Virginia, one of the nurses.
My name's Jennifer, I'm the insurance case manager.
And my name's Jennifer. I'm a social worker.
Hi, I'm Mindy. I'm an assistant clinical manager. I'll be individualizing your plan of care.
And we have Tony.
Yep.
So we're gonna start with the plan of care first. We'll go over that.
Okay. Now Victor, this is your actual plan of care that all of our nurses work with you here while you're here at Oakview, okay? The one thing is that we want you to be free of suicidal thoughts or thoughts to self-harm yourself and remain safe while you're on the unit, okay?
Okay.
We want you not to engage in self-destructive or disruptive violent behavior. We want to stabilize your depressive moods, okay? Now the three key things is that you'll attend PHP outpatient after your discharge, okay? The next thing is that you will verbalize insight into your medication compliance. And lastly, you'll verbalize insight into the overdose attempt that you had. Do you have any questions?
No.
All right.
That sounds good.
Very good. Now, Jennifer, the social worker, she'll go through with your master treatment plan as well.
So like Tony had just said, we want to make sure that you're able to do those things. And since you're getting better and you're able to do those things, we're going to discharge you back home because that's where you'd come from in the first place, right?
Mm-hmm.
And we're going to make sure that you have outpatient follow-up with Oakview at our program here where you'll be able to see a psychiatrist every day as well to help work on the medications if need be.
Okay.
And then we're also going to get you hooked up with a psychiatrist and a counselor to follow up to help make sure that you're working on things.
Okay.
Okay? Any questions with that?
No.
Okay. What is a good short-term goal for you?
To get better.
Okay. And what's a good long-term goal?
I guess would be to stay med compliant and do my follow-up so I stay better.
Good. Those are good goals. Definitely. Okay.
We'll go ahead and we'll have him sign that.
Okay.
The one thing is also, Victor, we are going to fax your discharge plan and your medication reconciliation to your next provider, your next therapist and psychiatrist, okay?
Okay.
Do you have any questions?
Nope.
All right, man, best luck to you, okay?
Thank you
All
very
right,
much.
thank you so
For
much.
coming in, Victor.
Have a good day, guys.
Thank you.
Thanks.
See you
It was nice
later.
to meet you.
Bye-bye.
Good evening. My name is Carl McLaughlin, Board Chair of the Southwest Community Health Foundation. Even though I couldn't be there in person this evening, I wanted to take the opportunity to thank all of you for supporting and attending this year's event. In addition, congratulations to Marty Boschka and Michael Kogan, this year's honorees. And finally, I couldn't pass up the opportunity and the privilege to introduce Mike Kogan, one of this year's honorees. As you know, Mike is the CEO of Northern Trust, and he has a wonderful family that includes his wife Jennifer, his daughters Caroline, Shannon, and his son Kenny. Mike contributes his valuable time to many philanthropic causes, and we're very lucky that the Southwest Foundation is one of his favorites. He's served on our board of directors since 2006, and he is the outgoing chairman of the Southwest Community Health Foundation, having served in that capacity for the last 3 years. His duties have included chairing the Foundation's Governance Committee, Executive Committee, serving on the Finance Committee, the Resource Development Committee, the Health System CEO Oversight Committee, and of course, being on our Capital Campaign Steering Committee. Through his focused and unwavering leadership, Mike has succeeded in reinvigorating the Foundation to ensure that it is capable of accepting fundraising challenges for years to come. This has required countless dedicated hours of work, and those of us on the hospital's boards appreciate his astute guidance. Under Mike's leadership, the Foundation implemented a 3-year strategic plan, reorganized its committees, revamped its website, conducted 3 golf outings, including one of the most profitable ones to date, and 2 tiaras. And as you know, during Mike's tenure as board chair, the Foundation commenced the most profitable campaign in the history of our hospital, having attained pledges that currently donate more than $7 million. Mike has worked tirelessly to assure the campaign's success, and the successes include the attainment of such major gifts as the largest gift in the hospital's history, that being the $3 million gift that Dr. Vasu Pandrangi, his wife Lisa, and their family donated. In addition, the gifts include 3 of the largest corporate gifts in the hospital's history. They total over $2.1 million, and they are from Medical Mutual, Parker Hannifin Corporation, and MTD via their Joachim Moll Foundation. And finally, these gifts include numerous gifts from members of the community like you and me. I could go on and on about Mike's accomplishments, but the bottom line is that his thumbprint will be part of this hospital's history for years to come. Mike, on behalf of the entire Southwest General community, we thank you for your vision, your leadership, your dedication, and congratulations on being one of this year's honorees.
bakery. Here at MFB, everything that we bake is free of the top 8 most common allergens. That's gluten, dairy, soy, egg, peanuts, tree nuts, fish, and shellfish. We also use healthier ingredients, so we like to make our sweet treats with a healthy twist. So we use coconut oil, we use coconut sugar, maple syrup, organic spices, chia seeds, fantastic flavors, healthy, nutritious ingredients, and allergy-friendly products. Straight today, we have our famous peppermint patty brownies and triple chocolate brownies. We have a taste of fall with our Dutch apple pie bars, and the end of summer with our peach ginger bars. We have lemon lavender cookies. So we transition as we're going into the fall. We'll have a lot more fall ingredients and options. Pumpkin donuts, we had those earlier. They sold out as well.
All right.
I'm now in the 3rd generation of ownership, which is myself. I'm Justin Miller. I've been born and raised in the stores. We have 7 stores in the Metro Detroit area. We are a Michigan company, always have, always will. My father and I run the business. And we have the largest gluten-free selection in the entire state, maybe the entire country. Over 5,000 items, all categories. So, you know, and we're even expanding into our prepared foods now and just trying to do our part and make it a little easier to find gluten-free items. Today we're making carrot quinoa pancakes, and I want to tell them a little bit about it.
Sure. The quinoa pancakes have some shredded carrots and chopped green onion, a little bit of sunflower seeds in them, and they are very good.
Yeah. They were created by Ruth Mossick Johnston, who's right here, who's Hiller's new director of prepared foods.
We do 3 versions. We do the carrot quinoa and sunflower seed. We do a zucchini quinoa and potato, and we do a new black rice and kimchi.
Yourself first. She'll apply PPE in this order, again, while the second person is observing and validating in the correct procedure. She will perform hand hygiene for a full 15 seconds, being sure to cover her hands and her wrists. She will put on the boot lower leg covers. She will put on her first pair of gloves. These gloves will be inside and under the isolation gown cuff. She will put on the head and neck hood. She will put on the isolation gown, being sure to secure all ties with a simple bow or self-adhesive tape. Her buddy will ensure that it fits well and covers the attended areas. You will use 2 gowns if the first gown is too small or there are gaps in the back. If using 2 gowns, the first gown will tie in the front and the second gown will tie in the back. In this case, the nurse is using 1 gown. She will apply the N95 respirator. Use the one that you have been fit tested for during your annual fit test. The strap placement will vary per manufacturer's directions. Be sure that the strap behind the neck is under your hair and do not cross the straps. Using both hands, she will mold the metal strip of the mask to both sides of the nose. She'll perform an N95 fit check per the manufacturer's instructions, breathing deeply in and out, feeling with her hands for any air leakage. If there's air leakage, she'll adjust the mask and check again. If she is unable to get a seal, she will not enter the room. In this case, she's done her fit check and indicated she has a good fit. She will put on a full face shield. The face shield is placed over the head and neck hood and the N95 straps, being sure to cover the forehead. This is something that the buddy can also check for her. She will put on a second pair of gloves. These gloves cover the gown cup completely. The buddy will check the front and the back of the nurse to be sure all PPE is on correctly and the nurse is completely covered. The nurse is now ready to enter the patient's room. When the nurse is ready to leave the room, she must use the patient call button to get assistance. This will allow time for her buddy to prepare outside of the room. While she's waiting for her buddy, the nurse will disinfect the outside gloves with 1 to 2 bleach wipes before leaving the patient's room, ensuring 2-minute contact time with bleach on the gloves before opening the patient's door. The buddy will prepare outside the room by placing the large doffing pad immediately outside of the room. She'll place the biohazard trash receptacle with the red liner on the doffing pad. She will place extra gloves and a bottle of hand sanitizer on the pad. The buddy will make sure there are no visitors, staff, or equipment in the immediate area. Once things are clear, she will knock on the door and let the nurse know she can come out. Once out of the room, the nurse will prepare to remove her PPE slowly, deliberately, without contaminating herself. The buddy will use the doffing procedure to help her safely remove her PPE, reminding her of the steps along the way if she needs help. The order of PPE is the following. Outside pair of gloves, using the glove-in-glove technique. Pulling off the first glove, rolling it into a ball, and then removing the second glove under the cuff. As each PPE is removed, it is gently and immediately discarded. Next is the isolation gown. She needs to untie the top, at the neck, and at the waist. The buddy again is standing by, making sure that no visitors and other staff enter the area. provides guidance as needed. After the gown is untied, she will use her inside gloves and reach under the cuff of the gown of the opposite hand. She will pull the sleeve over her glove. Using the sleeve, she will now grasp the other sleeve at the cuff and pull the gown sleeve over her gloved hand. She will carefully roll the dirty side of the gown into a ball, avoiding contact with her clothing or skin as she rolls it up, and then gently deposit it into the receptacle. Next to be removed will be the boot covers. She will grab at the top of the boot, make cuffs, and roll them inside out and down. Once the first boot is off, she will step to a clean area of the pad. She will remove the second boot and then step to a clean area of the pad also. She will now remove the inside pair of gloves, touching glove to glove, and then skin to skin. She will perform hand hygiene, but not leave the doffing pad. She will then apply new and clean gloves from the doffing pad area. Next to be removed is the face shield. She will grab it from the rear straps, pull the straps forward, and allow the shield to fall forward and away from her body. She does not grab the front of the mask or the shield. Next to be removed is the N95 mask. She will securely hold the lower corner of the mask, touching it minimally as she removes the strap from her N95 over her head. The hood may move forward during this motion. The head and neck hood is removed last, untying the back, touching it as little as possible, and gently lifting it off of her head. After all of the contaminated PPE has been removed, the nurse will step off of the doffing pad. She will gather it from underneath, rolling the dirty surface inward. Once the pad is discarded, the nurse will remove her gloves, again using the glove to glove and skin to skin technique. After gloves are discarded, she will perform hand hygiene. If at any time during the doffing procedure the buddy or the nurse wearing the PPE identifies contamination, the nurse will immediately wash the affected area with soap and water, will notify the nursing supervisor, and will change into hospital supplied scrubs.
Remember that when using PPE, avoid touching your face or mouth or adjusting other pieces of the PPE with your gloved hands. Also avoid touching objects or equipment in the room. All of the actions covered in this video are key for your safety.
It's my pleasure now to introduce the mayor of our great city, who's worked very closely with Southwest General to make this vision happen. And with that, Mayor Gary Starr, please.
Thank you, Tom. Thank you, Bill. It's a pleasure to be here today. I want to extend on behalf of all the residents of Middleburg Heights and the businesses of our great city, congratulations to Southwest General Healthcare Center. Typically, when a politician gives a speech, they introduce all the elected officials and dignitaries. The problem is it would go on for hours. So I'd like to acknowledge all the members of City Council, all the other fellow elected officials that are here from other communities as well. Congratulations to Tom Selden, to the trustees, to the doctors, the nurses, to the union workers who built this facility as well, to the architects, planners, administrative staff. It's been a pleasure.
This is Angie's Kettle Corn. We're made in Mankato, Minnesota. We're completely gluten-free, allergen-free, all three of our products, and we're not cross-contaminated at all. The facility is completely nut-free. All natural, 4 simple ingredients in both the light and the classic. The caramel has 6 ingredients that are all natural. It's made from a natural caramel flavor. It's not your typical drenched caramel mix. We're sold quite heavily in Whole Foods, Lunds Byerly's, Walski's, Rainbow Foods, Hy-Vee in the Minnesota region, but the full size of our classic kettle corn. The full size bag is 7 ounces. We also have a light variety and a caramel. And all three are completely natural, gluten-free, allergen-free, made in allergen-free facility. And great snack your whole family can enjoy, and you can feel good about giving to them. Well, I had 2 women come and take our samples of classic, and they kind of walked off and didn't see them. But 20 minutes later, they came back and they were ecstatic about how great the product tasted. Said they loved it, took more samples, and were very enthusiastic. So it's always great to meet fans. We know if people try it, they'll like it. And a caramel. And
Mildred? Hi, I'm Mary, and I'm taking your test right now. Oh, okay. Okay, good. Come on, honey, let's go. I put her in the form. Mildred, can you tell me your name and date of birth?
Mildred Doe, 8639, and I'd rather be called Mitzi than Sweetie or Honey.
Oh, okay. You don't have a dog named Mitzi. That'll be easy. I'll remember that. I see you're going to CAT scan after this?
Yes, I am.
Oh, hope you brought a book. They really are running late today. Mildred?
Hi.
Hi, I'm Marion. I'm going to be taking you for your test today.
Good, okay.
I see you're having a hard time getting up. Would you be able to walk about 40 feet?
Oh, yeah, I'm a little slow.
Would
I'll
you
get
like
there.
a wheelchair?
No, thanks for asking.
Sure.
No, I'll get there.
We're going out this way.
Okay.
Mildred, could you tell me your name and date of birth?
Doe, and it's 8639.
Great. And what name would you prefer to be called?
Everybody calls me Mitzi.
Oh, well.
Name. Thanks. Yeah, that's what they call me.
Oh, that's great.
You know, I'm a little nervous about all this today.
Oh, don't be nervous. We'll take good care of you.
I gotta go
And
to-
after we're done with this test, you realize you have CAT scans.
Yes,
scheduled.
yes, yes.
We'll take you down there,
That's-
and they'll make you very comfortable there,
Okay,
too.
that's the one I'm a little nervous about.
Oh, don't be nervous. They really do a wonderful job and try to make you very comfortable.
Okay, good.
Dearie, time to get up. Let's go. Who are you? It's time to go. We gotta get you out of here, you know? We don't want to send you back to a nursing home.
Nursing home? Who are you?
Well, and I hope this might hurt. Did you have your pain meds?
Who are you? Where's my nurse? Nurse! Nurse!
Good morning, Teresa. How are you today?
Good, thank you.
Well, it's very nice to meet you. Welcome. I'm going to close this door a little bit for your privacy.
Thank you.
What is your date of birth?
October 29th, 1926.
Oh my. Well, again, my name is Kara, and I've been a therapist here for 25 years. And it's my job to come help you get up so we can make sure that you're going to be safe when you get out of here. Do you have any questions before we get started?
Why no? What a lovely girl.
Thank you. You too.
Whatever you're selling, I don't want it. Hello?
Mr. Wright, hi, I'm Kathy Smith. I'm your nurse from Southwest Home Health.
Oh, you're my nurse. Come on in, come on in.
Thank you.
So, how long is this gonna take?
Well, that's a good question. We have a lot of paperwork to go through today. It's going to take about 1.5 to 2 hours, but you're home anyway, so you've got really nothing but time. And also, Dr. Jones would like me to get some blood work from you today, which we'll do at the end of this visit.
Oh, well, when will I get those results back?
Well, I'll take the results back with me to the lab. Depends on how fast the lab gets to them. Sometimes they're kind of slow. So I'll follow up eventually sometime today, and I'll call you when I get the results.
Wow, you're really efficient, aren't you? You're just a wealth of knowledge, aren't you?
Well, thank you. Are you ready to get started then with this paperwork?
Yeah, let's do it. Let's do it. Whatever you're selling, I don't want it. Hello?
Mr. Wright. Hi, I'm Kathy Smith. I'm your nurse from Southwest Home
Oh,
Health.
you're my nurse.
I
Oh, you can come in then. Come on in.
Thank you.
So, how long is this gonna take?
That's a great question. We have a lot of paperwork to go through today. It's going to take about 1.5 to 2 hours, and I know how important your time is to you today. So I will keep you informed as we're going along, how long it will take and where we're at in the process. And also, Dr. Jones would like me to get some blood work from you today, which I will do at the end of the visit.
Oh, when will I get my results back from my blood tests?
That's another good question. When I leave here, I'm going to drop them off at the lab, which will be in about an hour to an hour and a half when we're finished. And then I will follow up directly with the lab, and we should have results within about 2 hours. And I will call you and your doctor with the results. Is that satisfactory to you?
You know, I'll tell you, you are a wealth of knowledge. The duration of time you took to spend and tell me what I needed to know was excellent. Excellent.
Well, thank you very much. Are you ready to get started then?
Yeah, let's do this. Let's do it.
Dr. Brown is going to do a thoracentesis on you this afternoon. I need you to sign this permit for me. Here is a pen, look it over. I will be back in a little bit, okay? I have a lot of things to do. Thank you.
What exactly am I having done? What is a thoracentesis? I'm not sure what that is. I wonder if Dr. Brown's going to be there for me. Oh my, are they going to put me to sleep? Am I going to be in pain? How much is it going to hurt? Oh gosh, I'm afraid now. When is that nurse coming back?
Do you have that permit for me?
do. I have
Thank
so
you.
many
We'll be back in
questions.
a little bit later. I will try to answer those then, okay? Thank you. Hi, I'm Stephanie. I'm your
Hi.
nurse. Dr. Brown wants to do a thoracentesis this afternoon. I know he was in to explain it to you. Before I have you sign this permit, I really want to make sure you understand what he's going to do. Did he talk to you at all?
A little, but I don't really remember what he said I was having
Okay.
done. I'm really afraid. I'm worried
Okay, that's
what's gonna
understandable.
happen.
You know how you've been short of breath?
Mhm.
Well, what happens sometimes is you get a little bit of fluid in between the lung and the chest wall. So what Dr. Brown wants to do is go in, and you're going to have it done right here in your room. I'll be here, Dr. Brown will be here, and we take some of the fluid out to help your breathing, okay? Excuse me, what will happen is we will have you sit at the side of the bed. I will be facing you. We'll give you a pillow to rest, okay? Then we give you a little bit of numbing medication in your back. It's like a little pinch, and that'll numb the area. We clean it off first. Dr. Brown will then put another needle with tubing, and it goes to a bottle, and it's like with gravity, and that'll take the fluid out. We generally take like 4 bottles. Any other questions so far?
Will it be in a lot of pain after procedure?
You shouldn't have any pain after the procedures you do. We can give you a little bit of time. We can give you some Tylenol. You may have some coughing during the procedure. That's just because we're reinflating the lung as we take the fluid off.
Okay. Will my husband or my family be able to visit me afterwards?
They sure can. They can come in afterwards. We'll probably do a chest x-ray to make sure everything looks good.
Okay.
And we'll also take the specimens down to the lab to make sure everything looks okay.
Oh, good.
Do
Okay.
you feel a little bit better
I do.
now?
Thank you so
Okay.
much for
Well, I feel
explaining it
comfortable
to me.
having you sign this permit. So if you
Thank
can do
you.
that for me, that would be great.
Thank you.
All right, thank you. Okay, well, we'll see you back this afternoon. I'll be back in with him, and he's done tons of these, Dr. Brown, so you're in good hands.
All right, thank you so much.
Okay, you take it easy.
Yes,
Ms. Spencer.
yes.
Hi, my name is Vance Clark. I'm here to get you discharged. Are you ready?
I think I have everything except I could use a 4x4 to change my dressing.
Well, I'm sorry. At the moment, I'm really busy with other patients. Can you try to get that later? I just need to get you out of here.
Yeah, I guess that'll be fine.
Okay, well, I'm going to the wheelchair and I'll be right back.
Okay. Yes.
Hi, Ms. Spencer.
Hi.
How are you?
I'm good. How are you?
Good. I'm Vance Clark, and I'm here to get you discharged. I'm a discharge clerk.
Okay.
So, are you ready?
I think I have everything, but I could use a 4x4 to change my dressing. Do you think you could get me one of those?
Sure. Anything else you need?
No, I think that would be it.
Okay. How are you feeling?
I'm doing great.
Are you able to get up?
I'm able to get up with a little assistance.
Okay, what I need to do is go get a wheelchair. Take me about 5 minutes, and I'll be back with wheelchair.
That's great.
Okay, thank you so much for coming to Southwest.
Thank you so much.
Sure is a busy place. I hope these tests don't take too long.
Okay, honey, I have to take you for an EKG now.
Where are you taking me?
Trust me, you don't want me to do this in the hallway. Yes, I'm Nancy. I'm your nurse. Can you tell me your name and birthday?
Penelope West. My date of birth is 2/24/1932. You can call me Penny.
Okay, Penny, that's good. I need to do an EKG that the doctor ordered for you. An EKG is a test.
I've had them before. You don't have to explain.
Good. We're going to be moving to a private area because we have to lift your shirt up to do the test. We'll be right back. Okay, not so bad that test, huh? I'm going to be giving the EKG to the doctor to take a peek at. And I'm going to keep you informed as to how long the wait is. Here is the call bell for us. Okay. I have the screen for your privacy. Here's a blanket. Is there anything else I can get for you?
No, thanks very much.
Any questions? I have time.
No, I'm just going to sit here and wait and read my book. Thank you.
Okay, great.